Discussing a recall communication, that is teach a final year medical student regarding the therapeutic cooling in a term infant with hypoxic ischemic encephalopathy. So it is a therapeutic cooling or head cooling. So asked about the evidence behind the therapeutic cooling, how it was done using machine or with blood products. At 7 minutes, medical student will bring up then hidden agenda that his brother has cerebral palsy from birth related issue. That is what the medical student thinks, and he wonders if therapeutic cooling could have reversed the neurological outcome. Give empathy plus plus. State that therapeutic cooling does not reverse the neurological damage. So therapeutic cooling does not reverse the neurological damage, and we show empathy. So always all communication there is a hidden agenda we need to know. So as usual, we start like I at CP introducing myself, making report, taking consent, telling the agenda, attendance, and prior knowledge. Remember, in head cooling need oral consent, no need for written one. So first, what is that? We'll ask the medical student, what is your idea about head cooling or therapeutic cooling? It is induced hypothermia offered to babies born at or after 36 weeks of pregnancy. They have to meet the criteria A and criteria B within the first 6 hours of life. If 35 weeks meeting the criteria A and B within 6 hours, discuss first with the cooling center. If any doubt in the criteria of the case, generally consult the cooling center. So what is therapeutic cooling? It is a induced hypothermia of the babies, offered the babies at the early term of 36 weeks pregnancy. They have need to be meet some criteria A and B. And if we have some confusion about this criteria, then we can discuss with the cooling center. If 35 weeks but meeting the criteria A and B within 6 hours, then discuss with the cooling center. And if we have any doubt in criteria but term baby, then consult with the cooling center. Then what are the criteria A and B? We'll ask the medical student. Criteria A is that 2 at 10 minutes. That is, what are the 2 10 minutes? That is, Apgar score below or equal 5 and continued bag and mask resuscitation after 10 minutes. So after 10 minutes, two things criteria, that is, Apgar score below or equal 5 and we are continuous giving mask and resuscitations for after 10 minutes. Bag and mask resuscitation after 10 minutes. Then criteria, two criteria at 60 minutes. At 60 minutes, what are the criteria? pH less than 7 and BD equal or more than 16 millimole per liter. So I am again telling the criteria A, that is at 10 minutes to at 16 minutes, 60 minutes, 1 hour to 10 minutes, that is Apgar score equal 5 or below 5 and continuously we are giving bag and mask resuscitations after 10 minutes. And when at 60 minutes or 1 hour, then pH is less than 7 and BD is equal or more than 60 millimole per liter. Now about criteria B. What are the criteria B of head cooling or therapeutic cooling? Seizure or moderate to severe encephalopathy like altered conscious state, abnormal tone, abnormal reflexes. I'm again repeating the criteria B. It is seizure or any abnormal consciousness, abnormal reflex, abnormal tone, then abnormal conscious state, moderate to severe encephalopathy feature. These are moderate to severe encephalopathy features including altered the consciousness, abnormal tone, abnormal reflexes. Why we do this cooling? To slow down the brain metabolism, and this is in turn to slow down the brain injury. Why we do the cooling? Because slow down. Therapeutic cooling causes slow down of the brain metabolism and which causes slow down the brain injury. How can we do that? How can we do this cooling? That is, we are wrapping the child in the cooling blanket or let him sleep on cooling mattress cooled by cooling fluid or cooling gel. So use like a cooling blanket or a cooling mattress, he will sleep, the baby, or cooling gel or cooling fluid. Again, I am repeating, how can we do that? Head cooling or therapeutic cooling? We are wrapping the child in the cooling blanket or let him sleep on a cooling mattress cooled by cooling fluid or cooling gel. To which degree for how long? It is about 33 to 35 rectal temperature for 72 hours, then gradual rewarming about 6 to 8 hours. I am again repeating which degree and for how long. It is about 33 to 35 rectal temperature, 72 hours we are doing. Then after that, within 6 to 8 hours, we gradually rewarming the baby. And this time what we will monitor, that is rectal temperature, ECG and EEG. So we will monitor during therapeutic cooling rectal temperature, ECG and EEG. So this is all about head cooling, for medical student. Then we'll offer like do you want to make a seminar, then I will guide you what information, trusted website, leaflet, these are will give. And also in our agenda, the baby's the medical student brother has cerebral palsy. He thinks that if therapeutic cooling is that reverse the neurological damage. No, neurological damage cannot be, that already happened, reversed by therapeutic healing. We show lots of empathy. I'm really sorry hearing that. I can understand your upset. Everything will tell that some empathized line. And mainly, why we do the therapeutic cooling? To slow down the brain metabolism, and this in turn to slow down the brain injury. So this is all about therapeutic cooling communications. Thank you.